The medication reconciliation tool was developed at the Ann Arbor VA by a primary care provider/hospitalist who noted how difficult medication reconciliation was within CPRS and sought to create a safer and more efficient process. Medication errors are common and dangerous. Most studies estimate a 50% error rate at admission and discharge. The Institute of Medicine estimates that 400,000 preventable adverse drug events occurred in hospitals in 2016, costing upwards of $3.5 billion. As you can see, VA CPRS is not well designed to facilitate medication reconciliation. The Medications tab displays inpatient, outpatient, and non-VA medications in stacked sections, which makes comparison difficult. In addition, medications received from or documented by other VA facilities are not displayed at all, meaning the or joint legacy viewer to access the full list of a patient's medications. A visual comparison of the medication display from CPRS versus the medication reconciliation tool illustrates how much easier it is to reconcile medications across all of the healthcare settings. The first difference to note in the medication reconciliation tool is that all medications are compiled into a single master list, regardless of where they originated from. Next, note that medications are arranged alphabetically by indication so that similar medications are grouped. By grouping in this fashion, please note how easily the inpatient, outpatient, and non-VA medications from all sites can be compared. This decreases the risk of medication errors, especially during transitions of care. Another difference from CPRS is that the medication reconciliation tool was designed to support a team-based approach, meaning that medication reconciliation can be initiated by any member of the team, and their work is saved and may be used by other team members to review or complete the process.
In the outpatient setting, the medication reconciliation tool can be used to facilitate pre-appointment medication review, to create customized medication lists, to print prescriptions, as well as to print a nice-looking after-visit summary.
First, let's look at the medication list as generated by CPRS.
Note that the list has many abbreviations, does not contain indications, and is cluttered with supplies.
Now let's compare that list to a standard list generated by the medication reconciliation tool, and note how much more readable the list is. The medication reconciliation tool takes patient-friendly lists a few steps further by also providing a large font list for patients who are vision impaired, a wallet-sized list, as well as a pillbox planner style list. An after-visit summary may be printed from the tool to communicate medication changes, future appointments, primary care provider information, recent vitals, and vaccination history to the patient at the end of the appointment. You can also use the tool to generate a paper prescription that can be given to the patient or faxed to a non-VA pharmacy. Here's an example. On the inpatient side, the tool allows for reconciling of admission meds, with the feature of allowing multiple members of the team to contribute and save work.
At admission, the tool is organized to facilitate taking the best possible medication history, either on paper or electronically. This can be done by the whole team, from the ER pharmacist to the medical student to the attending.
The tool has a unique double-check feature that is used at admission and discharge. Once your orders are written, the tool will categorize them into helpful categories such as newly started inpatient meds, continued meds, held meds, or discontinued medications. The tool will point out potential errors in red. The tool will even calculate an accuracy score. We have friendly competitions between the inpatient medicine teams to see who becomes the weekly MedRec champion. From the double-check screen, the user can also discontinue remote medications. Yes, that's right, we said DC remote medications. The tool will automatically generate an email asking the remote facility to discontinue selected medications. This has been a very popular feature for our inpatient PharmD team.
The medication reconciliation tool makes MedRec at discharge much easier as well, and generates a clear, patient-friendly list that communicates new medications, continued medications, and discontinued medications in an easy-to-read format. A pilot study of the admission process was completed in Ann Arbor. It found a statistically significant decrease in the overall error rate, as well as the more severe error rate, when utilizing the medication reconciliation tool to facilitate medication reconciliation at admission. EPRP medication reconciliation measures have vastly improved in Ann Arbor due to the use of the medication reconciliation tool. This success has been duplicated in the Detroit VA system, and that site was recently recognized for excelling in EPRP MedRec measures.
Uptake in VISN 10 has been good, with more than 1 million uses and more than 5,000 unique users.
A pharmacist from Indianapolis reports that their entire pharmacy department uses the tool at every discharge, and that it is an extremely useful tool.
The MedRec instrument is simple to use, with user-friendly interfaces and executions. It ensures safe and accurate medication review on admission and discharge. Clear prescription instructions and changes are provided to patients in the form of discharge instructions. I love that this instrument is integrated into the Discharge Navigator, which has been an indispensable tool for our discharge process.
We would love for everyone throughout the VA to use the Ann Arbor MedRec tool. Who knows? Maybe we can all become MedRec champions.
Thank you so much for considering the Ann Arbor MedRec tool as a submission for the May is Med Recon Awareness Month competition. Please don't hesitate to call us with any questions.